Your hosts are Dr. Stephen Katz, an award-winning naturopathic doctor and former president of the Arizona Naturopathic Medical Association. Also, Dr. Loreena Ryder, naturopathic doctor and current board member of the Arizona Naturopathic Medical Association.
Good afternoon and welcome to Your Health as Wealth. I'm your host, Dr. Stephen Katz, alongside with my co-host, Dr. Loreena Ryder. We are licensed naturopathic physicians. We're here to help you navigate your journey to wellness. We like to do it simply without all of the confusing medical terminology that everybody hates. And we're here to provide practical solutions to your health issues that allows your body's healing systems to do the work for you. It's simple, it's natural, and it works. If you're still struggling with your health, come see us at Naturopathic Physicians Group to help get your life back. Now, we always start every show with, what is a naturopathic doctor?
Hi, I'm Dr. Loreena Ryder, and I'll talk a little bit about what a naturopathic doctor can do for you and how we're different from a traditional medical doctor. We can provide primary care and also specialized care. It depends on the focus of the particular naturopathic doctor. We look at the body as a whole. We determine the root cause of your symptoms. We treat the cause rather than treating the symptoms. So we go in and find out the root of the issue, and we go toward that direction for our treatment plans. One of the main differences while you're in the office is that we spend a lot more time with you than you're typically spending at a traditional medical office. Our first initial appointment is 1 hour, and most of the time we're very thorough in our questioning, and we ask questions that most people have not heard from a traditional doctor. We believe prevention is the best form of cure. We want you to get better. We want you to stay better. And we want you to have a better quality of life moving forward.
When you see traditional medicine, when you have your appointments, they're generally a few minutes long if you're lucky. There's no way you can get to the root cause of problems that way. So you end up getting stuck in a rabbit hole to where your treatments are based 100% on the only thing you can talk about in the office, which is symptoms. So you end up getting put on this one, you get side effects from it, you get put on that drug because of the side effect, and then you get put on the next drug because of the side effect. You get this revolving door, or you can get even luckier and you can get sent to a specialist who will treat this thing, and then something else goes wrong, they'll send you to a different specialist, treat that thing, and you get that revolving door. When you see a naturopathic doctor, you're getting all in one. We're going to take that time, spend an hour with you, which is a lot of time, but it's a lot of times not even enough. We actually go through your entire history. We find out the right tests to do, the right causative test to do to be able to treat you, get you better, keep you better, get you off the meds. If you're sick of taking meds, sick of going to the pharmacy, it's what naturopathic doctors do best.
Right. And it's good to have more than one head in the pot as often as not, more often than not. But whenever you have that scenario that you're talking about, it's not the best. But we like to tie everything together, and we will look at other, doctors' treatment plans and what they have going for you, and we try to
do the right treatment plan.
Yes. Yeah.
It's kind of important if you do the right treatment.
It is.
It helps.
It matters.
So every single week we pick a different topic. This week our topic is headaches. So we're going to go over a lot of the most common types of headaches people go through today, the symptoms that are associated with it, the types of labs or exams you would get done, as well as naturopathic labs you can get done. And then we talk about treatments, both conventional and natural treatments, so we can not just help you get rid of your headaches, keep them from coming back.
Yeah, we have a lot of information to get through today. I don't know of anybody who has not experienced a headache in their life. If they haven't, I'd like to talk to them. That'd be interesting. But we'll start out with defining and just talking about the different types of headaches that people experience.
And we're talking about internal headaches, the ones that are actually happening in your head, not the external ones that are living at home with you.
Uh-oh.
Just kidding.
So first on the list, tension headache. That's fitting. I think we all have experienced tension headaches, and it's just from basic everyday stress. It might not even be everyday stress. It might be a stressful situation that you've encountered. Those headaches are deep, dull aches at both sides of the head. They can last anywhere from half an hour to several hours. And dehydration can be a factor. Stress and anxiety, lack of oxygen, lack of exercise, poor sleep. And also if you're sitting, working at a desk on your computer, your shoulders are up and you're like trying to reach that deadline and just putting all of that tension into your shoulders up to your head?
So there's a lot of similarities from different headaches, but all of the common headaches tend to have a particular tell to them on which one is which. That doesn't mean there's not overlap, but when you're talking about tension headaches, the real key to understand is that one almost always kind of feels deep. Like you said, deep dull. It's not in the front of your head. It's not the back of your head. You generally kind of feel, these are the headaches when I get them to talk about their headache, they're like, it just feels like my head, the sides of my head, and it just feels like it's like embedded in there. And they last usually for under an hour, but they can last for several hours. But dehydration and stress and anxiety, that's why they call them tension headaches. So if the body's under stress, whether it be a coworker yelling at you versus a spouse yelling at you, I'm doing it again. I love my spouse, I promise.
And these differentiation between headaches, I know we've just talked about one so far, but this is what we're talking about with naturopathic medicine, where we will ask specific questions, because I know, most people will have a headache and they're like, it's just a headache. It just hurts. My head hurts. So we start asking the differentiation question as to what does it feel like? Where is it located? And the quality of the pain.
And two of the big causes of tension headaches are poor sleep. If you're one of those people that wake up with headaches, sometimes you'll get them in the middle of the night. But if you have really bad sleep, this one increases the stress in your body, which then can lead to tension headaches. And these are the overworkers, the ones that are sitting in front of the computer all day long, typing all day, the ones that are watching TV. Those 85-inch TVs are awesome, but if you're staring at them all day long, you can actually start to get that strain in your eyes, and you can actually start to experience tension headache.
And your head is pretty heavy. I think it's on average, 8 pounds, and then your neck is holding that up. So if you're sitting there holding it up in an angle that you shouldn't be, then that's also stressing those muscles.
And if you have really large brains, your head might weigh 10 pounds, which makes the tension even worse.
There you go. So cluster headaches, they're another type of headache. These are severe. They happen over and over again. People will describe an intense burning or piercing pain behind or around one eye. These come on very quickly without any warning. You can have as many as 8 in a day. Usually they're the same time of the day, have the same cause, and they can be caused from alcohol. They can be exacerbated by alcohol and smoking, and these happen more frequently in males.
Yes, cluster headaches, they feel clustery. The reason why they're called clusters too is because they're recurrent. You can have so many in a day, so they're clustered together in the process.
And I think we've all heard of migraine headaches. These are intense, 10 out of 10 pain. They can last for hours or days. And they're generally one-sided. You might have some visual disturbances, light sensitivity, and these happen more in women than men. And we can talk a little bit more about the migraine headaches. Today's topic, headaches, and how to help you get relief without drugs.
I do a segment called What Isn't Your Doctor Telling You? And again, this is not to say that your doctor is wrong or telling you bad information or not telling you information. It's just when you have a short visit with a practitioner, there's just not enough time to go through all the details. So I like to give a tidbit that not everybody might know when it comes to health. Today, I'm going to say painkillers can actually increase both the severity and frequency of headaches. So when you get your headaches out there, and the first thing you want to jump on is anti-inflammatory, a painkiller, understand that when you take these, you're not treating the cause. You're using these meds to numb or take down the pain. Your body will actually get desensitized to the medicine, which means that it'll take more of the med to get the same effect, therefore likely increasing both the intensity and the duration of the headaches. It is as if and what's even worse is if you use an anti-inflammatory painkiller, then you actually slow the healing down, and the injury that caused the headaches will actually get worse.
I know I've experienced this actually whenever I've had headaches in the past before I found out the actual cause of my headaches. And I was taking ibuprofen, and I started out with 2, and then I had to take 3, and then you have to take that number multiple times a day. So I have definitely personally experienced this.
Yeah, and I used to get headaches as well. I haven't had headaches consistently in a really long time. And I found out I was allergic to cashews, and I used to eat the mixed nuts all the time. And when I would eat them, I'd get a headache. And when I stopped eating cashews out of the mixed nuts, lo and behold, my headache stopped.
And cashews are quote unquote a health food, right? So why would anybody think that might be something that's bad for you? And we'll talk about that a little later on in the show. But right now we can finish up the types of headaches. So in the first segment, we talked about tension headaches. Everyone is pretty familiar with cluster headaches, which many people have not heard of, but they are definitely a painful headache. We were discussing migraine headaches when we went on break, so let's go back to that a little bit. So these are headaches that are more prevalent in women than men. Triggers that can cause migraine headaches are stress and anxiety, just like tension headaches, poor sleep also, your diet can be a main contributing factor to migraines, just like we were talking about with the cashews with you.
We have cured migraines for a lot of patients, actually testing them and finding out what they're allergic to, and their headaches go away.
That was me. That was me for sure. I had whiplash in the past. I had been in a couple of car accidents, and I had always contributed my migraine headaches to, oh yeah, I was in a car accident. I'm doomed for life now. I get migraines every so often. But when I checked my food sensitivities and took those out of my life, as painful as it was, lo and behold, my headaches disappeared.
And as you said, women get them more than men. Men are probably part of the reason why women get them more than men.
No comment.
I'm probably a known cause of migraines in my family.
Giant, no comment. Other things that can cause migraine headaches are bright lights and loud noises, and it can also exacerbate those as well. And I think everyone knows what I'm talking about there. Hormonal changes, that's something that needs to be investigated when someone is having migraine headaches as well. And these are the 10 out of 10 intense, generally one-sided head pain. Some people miss work and even, fun recreational activities due to these migraines.
These can last days. Sometimes you'll have to go in your room, lock the door, and you're there for days because it just will not give any relief. And 25% of all migraine sufferers will have some kind of event that happens right before the migraine. It's usually known as an aura, but they might see a visual or some kind of disturbance, oftentimes in the eyes, loss of vision. You can see lightning bolts or zigzags. You see something like this, you might get numbness or tingling down your body out of nowhere, and then that's your trigger, and all of a sudden, hour later, you have a migraine.
Most people know these are coming, and they can tell. They kind of prepare their environment for it. They make sure they have a dark room ready. They get, their medications ready, ice, whatever they need.
And unless there's a trauma or an injury, the younger you are, the more likely it's going to be linked to something like food. If you're a young kid like 7, 8, 9 getting migraines, you haven't been beaten down by the world yet. There's not a lot of causes. So diet is a big one to look at.
Yeah, that's a good point. I remember being probably around 9 or 10 years old, and my mom would complain about headaches often. And, I was out in the summertime running around in my bare feet all through the valley of the hills of Pennsylvania, and I had never, ever had a headache in my whole life. And I often wondered, why does my mom get a headache? What is a headache? What's that feel like? And then one day, I'm pretty sure I was dehydrated, I got head pain. And I thought it was big stuff. I was like, oh yeah, I'm grown up now. I have a headache. But, that was the first of many that I didn't want.
Which you said dehydration. That leads right into our next headache, which is dehydration headaches. Some of the most common headaches people get out there because people don't drink enough water. We did a whole talk on this not that long ago. Water's important. Oxygen, again, circulates the body. When you don't drink enough water, or if you wait till you're already thirsty, you're already too late. You start getting a headache. These tend to be dull, but they're usually not really intense headaches. You can get them intense, but most of the time, these headaches are kind of that dull feeling, and they're just annoying. They're there. Your head hurts, but you get through your day and you keep moving through. But it's amazing. Big information here. When you drink water and rehydrate, they almost always go away. Magic.
Yeah, even if you just chug down 1 or 2 water bottles, it can almost be that quick.
These are most common in the morning too, because people won't drink a lot of water before bed because they don't want to pee all night. Their body gets dehydrated through night. They wake up with that headache. Very common in there. And this one also generally has other symptoms with it because you're dehydrated. So thirst. If you have a headache with a lot of thirst, it's probably a dehydration headache. If you have dry mouth or dry lips, well, water, dehydration headache. Dizziness or lightheaded. The most common symptom people get with dehydration is they'll feel lightheaded or a little bit of dizziness. If that is associated with a headache, very likely going to be linked to a dehydration headache.
Yeah, it's so simple. And so many people suffer from it. Sinus headaches. So many people who have sinus issues, seasonal allergies may have these, maybe a couple times a year. Sometimes they suffer from them all year long, but typically they're just whenever you're having, those flare-ups, or if you have a sinus infection or some sort of head cold that you're dealing with. These feel dull and throbby and achy around the eyes, the cheeks, and the forehead, which is where your sinus cavities are located. The pain might worsen with movement, such as like if you bend over and your head is lower than your heart and that blood rushes there, you're going to feel that throbbing even worse.
And a lot of people will experience this pain and then they'll say, I also feel like this right after dental work, or I need dental work, and they're getting a headache associated with that. This one can actually have some radiation with all of the pressure in the sinus cavities and can actually feel like teeth pain.
I can't remember which one of my daughters said this, but when I was talking about sinus cavities, they said, wait, what? We have holes in our head? Yes, those are the sinus cavities.
And you can look right through one ear and out the other ear on a lot of people.
Yeah, no, I've never tried it, but
if you see mucus there, then maybe they're getting sinus headaches.
Yeah. Straining. So if you are straining to pick up something or straining to go to the bathroom, which you shouldn't, but these can cause increased pressure and increase these sinus headaches as well.
These are really common in people with allergies, chronic sinus infections, the ones that are like, I need an antibiotic, a Z-Pak 5 times a year because I always get these sinus infections. If they're getting headaches associated with them, it's very likely common because they're getting all that pressure in their sinuses, leading to a lot of issues.
Yeah. And you can feel this in your ear as well because, you've got the cavities there. This is equivalent to the sinuses, the ear pressure, the pain, and yeah, the tooth pain can be a real thing.
And yeah, the caffeine headaches are some of the most common ones as well. These can be very severe. They are linked to sometimes 10 out of 10 like migraines. But this one has a very obvious cause. Caffeine withdrawal. These are so common because we drink way too much caffeine in this country and around the world. When does this happen? Basically, the rule of thumb is if you're drinking more than 4 cups of coffee per day, you are likely addicted to caffeine. How fast can this actually turn into a problem? Well, if you've been drinking that much coffee or caffeine for 2 weeks, you can already be addicted. It's fast. And when you're dealing with stuff like that, withdrawal can happen anywhere from 12 to 48 hours after stopping the caffeine. And your withdrawal symptoms could last up to 9 days. So caffeine, again, is a stimulant, but it's not the best thing in the world to do because it's a drug. It's a stimulant. If you continue to feel like your health is more of a struggle and not an afterthought, we are here to help you regain control of your health. I'm Dr. Stephen Katz alongside with Dr. Loreena Ryder. We are talking today about headaches and how natural treatments can be used to not only stop the headache, but even prevent them. We like the song Mission Impossible because we take your journey of trying to get better that you feel is impossible. We like to take that impossible feeling and make it possible.
It's the only time I feel like a hero, which is a good thing. Our topic of the day today is headaches. Almost everybody has experienced a headache and has them even on a regular basis, unfortunately. I like to give a tip, a little bit of information that you can take and use at home to help your health, and it's on headaches. So what we try to do is decrease the blood flow that's going to the head, and so that it reduces the pain involved in a headache. So what you can do is put your ice on your head, which many people have heard of and do whenever they have a headache. But then also at the same time, put your feet in some very warm or hot water so that it pulls the blood from your head down to your feet. And that way it takes away that throbbing nature of the headache. You can add a little bit of aromatherapy oils, maybe some lavender, something calming and soothing while you're doing that, and just sit there and wait and relax.
Do you remember that product Head On?
Oh,
headaches?
the roll-on?
Yeah, the apply to your forehead and the headache goes away.
Yes.
Yeah, I started rolling that on people I didn't like. None of them disappeared. So the headache never went away.
Oh my God. Yeah, that was false advertising.
I didn't think it worked because you thought if I put it on them, they would have just disappeared because they were the headache.
I would have never thought of that, but do they even still make that?
Again, it's because when you put it on the people, it
didn't work.
They didn't disappear. So I just don't think it's there anymore.
Oh my gosh. So we were talking about caffeine headaches, and we're just going to finish that up a little bit. So we talked about too much caffeine causing a withdrawal whenever you don't have it, which then in turn causes a caffeine withdrawal headache. Now, there are a couple of over-the-counter medications that are headache medications that actually include caffeine. I think Excedrin is one of them. I think Midol is another one. I don't really remember. But they're very effective, and that's because most of us are used to having caffeine on the daily basis, and we might withdraw from that. And then another reason, caffeine is a vasoconstrictive drug, so it reduces the size of your blood vessels, which works the same way. What I was talking about of putting ice on your head and heat on your feet, it constricts those blood vessels in your head, therefore reduces the pain.
And as we were talking about how a lot of times to differentiate between the headache, the other symptoms that go along with it can help you with that. Well, when you use caffeine, it gives you energy. It helps with brain fog and concentration. So if you stop the caffeine and you're getting a headache and all of a sudden you feel brain foggy, or you're not able to concentrate as much, or you feel irritable, all of those things can be associated as a symptom that go along with the headache to show you're actually in caffeine withdrawal.
Yeah, and a lot of times people say, I just need a coffee, and it'll fix my headache.
And yeah, for sure. And then one of the headaches that often goes untreated and said are injury headaches. If you actually damaged your neck, whether it be hitting your head, but a common one is whiplash with a car accident. When you get whiplash, you damage the ligaments in the back of your head.
And they go all the way down your spine, those ligaments do.
And a lot of times they don't heal. And if you don't get in there and actually heal that damage, you can have headaches for life.
Which is what I thought was happening, but turns out it was a food sensitivity. Now, I did have whiplash headaches right after the injury, and, for a good 3 months after they went away. And then, a few years later, they came back. Oh, must be that old injury. But it wasn't the case.
And the whiplash usually occurs at the top of the base of the neck, the top of it.
The hairline.
Yeah. So when you're talking about these headaches, they tend to be in the front. So the higher up on the neck, generally, the more front the headache will feel if you have the damage in the neck. So if you have headaches and you have damage in the back of your head, oftentimes it actually could be your lower neck cervical region that can actually be damaged, causing the headache in the back.
Yeah. So that wraps up our type of headaches, right?
Yes.
So now we need to talk about what to do about it. So our treatment options. So there's plenty of treatment options that we can offer as naturopathic physicians. And one of my favorites is regenerative injection therapy. And those are good for injury headaches and whiplash headaches that we were just talking about, because we need to regenerate that tissue that was damaged. But they're also good for migraine headaches, as long as you are treating the cause of those migraine headaches and diagnosing those properly.
So regenerative injection therapies, we did a whole talk on these earlier, but it was basically pain treatments like prolotherapy and PRP, which stands for platelet-rich plasma therapy. These are treatments where we actually use your immune system to guide the injuries to heal. When you see an orthopedic doctor, oftentimes they're going to use steroids to treat your damage. Steroids are anti-inflammatory, so they feel better short term, but it actually makes the injury worse because our bodies use inflammation as a way to heal. So we kind of use guided inflammation to send your immune system to the right place to actually heal the damage. So if you had whiplash, if you have trauma in the neck that's causing your headaches, not only will the treatments help treat the pain in your neck, it can actually get rid of your headaches.
Yeah, the steroids are degenerative whenever it comes to the tissues, and we want regenerative, and that's what the Prolo and PRP does. Another naturopathic treatment for headaches is diet. And we talked a couple of times here about Dr. Katz and his cashews and me and my several food sensitivities. You remove them. Well, you need to test for them. You need to test at a naturopathic doctor's office to ensure that you're getting the proper food sensitivity or food allergy test. And then you just simply remove them. Now, I say simply, but it's not so simple because food is a very intimate relationship.
If you've been to an allergist before and they did this skin test on you and they test some foods when they do the skin test, oftentimes they come back normal. That does not mean that you are free of any food allergens. When they do the skin test, they're only measuring one particular antibody known as IgE, which stands for basically an immediate reactor. They test these. So if you have had anaphylactic where your throat swells and you can't breathe after you eat, need an EpiPen, those are the type of reactions that you get from these. But the most common that cause headaches when it comes to food are known as IgG reactions. These are the gut sensitivities. These are the ones that when you eat the food, how your body digests the food, and then the response that happens. Oftentimes that response can be a headache.
Yeah, and the IgG responses are delayed. They're not immediate. So they're not anaphylactic. They can be 3 hours later. They can be 72 hours later. You might eat a food and have an inflammatory response a day or two later, and it's really hard to identify which food is giving you that reaction.
And the most common foods that are linked to it. Again, testing it is the right way to do it, though, because if you don't test and you try the elimination game, I've said this before, it's like playing darts without a dartboard. You can't keep score. It's very hard because you could have a healthy food that you're eating every single day causing problems.
Yeah, it's so difficult. And you were going to say the most common? Go ahead, you say it so I'm not the bad guy.
Most common foods are dairy. We're not cows. Don't drink milk. Gluten, just bad, inflammatory, breaks down into sugar. Sugar is bad. And all the artificial junk out there, don't eat any of that crap. Eat real food, and your headaches can go away.
Absolutely. Today, we're talking about headaches. So let's finish up what we were talking about naturopathic treatments, and so we're going to continue talking about that. We had ended on food sensitivities.
And you don't have to always go to a doctor to treat some of your headaches. Again, if your headaches are due to dehydration, it's the easiest fix in the world. Drink water. And we had a whole topic on the different types of water, and I was mean to RO, but we fixed that.
Yeah, no, everything can be fixed, I think, almost everything anyway. But yeah, hydration's super easy to fix. And I know it might not be, and we say that it's easy, but it can be difficult for some people to get enough water in. But there are little tricks along the way to help your body get that in. Maybe trick it with a little bit of good tasting electrolytes that are flavored with some plant-based sweetener.
Yeah, and if one of your causes of headaches are due to smoking or drinking alcohol, because that is a common cause of cluster, tension headaches, withdrawal headaches, there are treatment options you can do on a natural side to help you with the quitting of the smoking, quitting of the drinking. And one of the really good ones is acupuncture. Mm-hmm. Acupuncture, there's actually protocols to actually help curb the cravings, alcohol and smoking. So if you feel like and it also helps with the withdrawal symptoms. So if you feel like you need help quitting, you've tried a lot of different options, never tried acupuncture. Acupuncture could be a really good one to help, not only help get you off of the smoking and the drinking, but it could also help with the headaches you get from the withdrawal.
Yeah, that's a bonus. And it is easy to just say, we'll stop smoking or stop drinking alcohol, but we're here to help you in that journey because we know that it's not just that easy. You can also get into some therapy to use to deal with the stress and anxiety that might be causing your headaches. We offer a therapy called neuroemotional technique, or NET, at Naturopathic Physicians Group that it can help you with the stress and anxiety that might be associated with your tension headaches.
Therapy is really important. Look how the world is right now. We all need somebody that's not related to us to help us cope with things. It's not that you're crazy. Therapy gets a bad rep by a lot of people. They think, oh, you see a therapist, you must be nuts. No, we need outs that aren't family. Somebody who can help us cope through this. And having a therapist is a really good way to help. And if you're having anxiety or stress, and those are linked to tension headaches, cluster headaches, and a lot of other problems, the therapy sessions can help you manage that, which then allows you to get relief. The stress, the anxiety gets better, and your headaches get better.
I think mental health therapy should be a part of our daily living. We have V therapy. We have acupuncture therapy. I think mental health therapy should be as regular as those things.
And you said IV therapy. There has actually been over 20 studies that show the effects of treating and preventing headaches, including migraines, using IV therapy. So it's not like this is something we pulled out of our butt. Studies have shown that when you do nutrients in the IVs, because it bypasses the digestive tract, it goes right into your bloodstream. A lot of those nutrients that we put in the IVs are linked to, or deficiencies of those nutrients are linked to headaches and migraines. So when you do IV therapies, there's been over 20 studies that show that they can help not only prevent, but also treat if you're in a really bad migraine.
Oh, yeah. I honestly believe IV therapy should be part of our monthly treatments to ourselves. I love getting monthly IV therapies at the office.
And at home, a really cheap treatment if you're having a bad day is Epsom salt baths. Epsom salt is magnesium. Magnesium is a relaxer, and we'll talk more about that in a second on all the benefits of magnesium. But Epsom salt baths, you pour it in your tub, follow the directions, and it actually can calm your headache and migraine down.
Right. And just like whenever I was talking about putting your feet in hot water and ice on your head, breathing in a little lavender, just drop some lavender drops in your bath whenever you're using some Epsom salt.
And if you're not doing magnesium in a bath, what about taking magnesium? Now, before we go into these nutrients, we have to say we're trained professionals. We give the right dosages to our patients. So we're not telling you, we're not advocating you to go out and buy all these supplements. But if you see the right person, you might be able to get a lot of relief using these.
Yeah. So magnesium is something that just seems to flush out of our bodies pretty quickly. And then also, we don't seem to get enough of magnesium. Now, you can get it from food, green leafy vegetables. I can guarantee that 50% of us don't get the recommended daily dose of green leafy vegetables. But magnesium is captured sunshine, basically. It's the green, part of the vegetable that gives us the benefit.
It is one of the most common nutrients that we lack in our bodies. It's necessary for proper nerve function, muscle function, and blood flow. So think about headaches where you feel like you're not getting blood flow to your brain properly, and you feel like your head is just stuck. And muscle, if your muscles are weak or your muscles are tense, magnesium helps relax that.
Yeah, and B vitamins. B vitamins are very important for headaches, specifically B2, but all B vitamins will reduce headaches.
Yeah, so a B complex oftentimes can actually make a lot of benefit, or can actually help you a lot of benefit to it when it comes to headaches. But B2, there's been lots of studies on B2 as well, because it actually decreases the free radicals, the damaging stuff that's circulating your body that causes inflammation. It actually helps decrease those damaging free radicals and reduces inflammation. Therefore, it's been shown in studies to decrease the intensity of your headache.
Be sure to take your Bs. They're so important. And then vitamin D is another supplement that's very important. Vitamin D acts as a hormone as well as a vitamin, and it's involved in almost every chemical reaction in the body, many chemical reactions in the body.
And they have definitely found in studies that a deficiency of vitamin D is linked to migraines. It's not the only cause, of course, but it's definitely a link to it. And unfortunately, when you get your blood work done by traditional medicine, they're using a category of what they consider normal vitamin D level, and it's deficient. They used to be much better markers on regular vitamin D. Now they're using markers that are lower So they're telling people that they're not deficient in vitamin D when they are deficient in vitamin D. And that's scary.
It's a simple blood test, and I run it on every patient of mine. And if I have somebody that's actually sufficient in their vitamin D, I'm surprised.
And we already talked about how magnesium is linked to helping prevent migraines and treat other headaches without the side effects. Well, vitamin D helps the absorption of magnesium. So if you don't have enough D, don't have enough mag, it can combine each other and make problems. But vitamin D, they did an analysis of looking at a bunch of really good studies, and they found out that when you take vitamin D, it significantly decreased the duration, the frequency, and the severity of headaches compared to taking a placebo.
Yeah. Yeah, let's talk about CoQ10, coenzyme Q10. It's a really great antioxidant. It's really great for your heart, but it can help decrease in migraine attacks as well.
It's really good at helping protect from nerve damage and inflammation. It decreases the nerve damage and decreases the inflammation, which can help across the board. There were actually 6 studies that were done that found that CoQ10 actually reduced both the duration and the frequency of headaches.
Melatonin, that's one of my absolute newest and favorite things to take personally. It's a really great antioxidant. Turns out it also helps reduce headaches and migraines.
Lavender. We talked about lavender a little earlier. It's an essential oil, really helpful for tension headaches because you can actually use it for anxiety and stress. So a lot of times you can take the essential oil, rub it on your temples, on your head, and it can actually reduce the headache significantly.
Yeah, it's fantastic. Now, I do think it's important just to say this while we're doing this segment here is that you really do need to get some traditional tests done to make sure that there isn't anything serious happening behind the headache. Like you should have, if you're waking up every single day for 2 weeks with a headache, if you're losing your balance and falling over, if you're seeing black spots, you really need to get to a doctor and get an MRI or some sort of a CT scan or something.
Rule out all the major dangerous stuff for sure. But on the other hand, though, if you're going to the doctor and all they're doing is treating you with drugs, there's much better options than that as well.
Right. And also get your blood pressure checked too. You can do that really quick and easy at like a CVS or something.
So thank you for joining us today on Your Health is Wealth. We're here to help you take charge of your own health, increase your quality of life, and support your natural healing process. If it's often simple and it works. We're the doctors Stephen Katz and Loreena Ryder. Please join us for another episode.
Thanks for listening to Your Health is Wealth. Be sure to tune in to learn more wisdom on how to live a fuller, richer life. If you have questions about today's show or would like to find out more about the topics we discussed today, call the Naturopathic Physicians Group at 480-451-6161.